Tonight in our COVID conversation, researchers at Cedars-Sinai Medical Center in Los Angeles say a coronavirus variant discovered here in California is likely what led to that surge in cases we saw over the holiday season. For more on this, we're joined tonight by the co-senior author of the study, Dr. Eric Vail. Dr. Vail also is the director of molecular pathology at Cedars-Sinai. Dr. Vail, good to have you on tonight. Appreciate your time. Can you first tell us what the process was to identify and track this particular variant that was showing up here in California?
Sure. So we actually started off looking for the UK variant around New Year's Eve, and we ended up sequencing a large component of tests that have been done over the preceding month. And while we didn't find any of the UK variant, we did end up finding this California variant that was about 40% of the samples by the end of the month. And it really just appeared out of nowhere in October and then took over from there.
And you believe, you're confident that this is the strain that likely led to that big surge in cases that we saw over the Christmas holiday, over New Year's, and after that. What did you see in terms of the numbers of cases of this variant and how they emerged over that time period?
Coincided with the surge, but I wouldn't say that it's actually the main reason for the surge itself. The main reason for the surge itself is the main reason for pretty much all of the surges that we've been seeing across the world, and that's when people congregate together. Remember that in October we had very, very little coronavirus cases, and people started to get a little more comfortable around the holiday season, going out to see family, maybe not socially distancing, wearing masks as much. This strain, this variant, most likely played a role in how high, how many cases ended up happening, how high the peak was. But the actual surge itself was sadly just due to human behavior.
Yeah, that's just people, not practicing those safety measures. How does the California strain that you identified compare to some of the other strains that are out there? The UK strain, the strain from Brazil. What do we know about its transmissibility?
Sure. So we can see that from the numbers that we see, the fact that it's taking over the local area, that it definitely is more fit for the area right now. There are no hard numbers like we've been hearing from the UK strain or Brazil or South Africa, 30, 40, 50% more infectious. We don't have those numbers yet right now, but there are multiple teams, including our own, working across the country to kind of get those numbers right now and get numbers on virulence, so how dangerous or if this is more dangerous or not.
Right. And then, of course, there is the all-important question of whether you believe the vaccine that we have right now, or the vaccines, I should say, whether they are going to be effective against this California variant.
There's absolutely no evidence to say that the vaccines would be ineffective against this variant. Even all of the data that's coming out for the UK variant showing that the vaccines are effective. There is some evidence with the South Africa strain that there may be some less effectiveness, but even a little bit less effectiveness from a very high peak is still very high. And I think we should all strongly encourage anyone that has the chance, has the opportunity to get a vaccine, to absolutely get a vaccine whenever they can.
Absolutely. As we wrap up here tonight, let me just sort of ask you broadly about the kind of work and the research that you're doing there. How likely is it? I imagine it's pretty likely that there are a lot more variants out there that have not been detected yet. It sort of shows the importance of this kind of work to sequence these strains, identify them, and track them.
The reason that the UK strain was the first, or the UK variant was the first one that was really publicly known about, is because the UK has an amazing sequencing and tracking project where they've sequenced almost 6% of their entire COVID population since the start of the pandemic. They account for half of the world's sequences at this point in the public databases. And so I think that the lesson from this is if you're not looking for it, you're never going to find it. And so I think that's what public health agencies around the world are doing right now.
All right. Well, kudos to you and your colleagues on the work you're doing there and continuing to do. We appreciate you taking some time tonight. That's Dr. Eric Vail, who